In today's video, we're going to be talking about how to handle back injuries. Before we start talking about the specifics of what it is that you need to do, I'm going to show you a couple things here. So we're going to look on this chart on the wall here, and when we look at the structure of the body's not perfectly symmetrical, but we want the body to be as symmetrical as it can be. Many times when people have back injuries, there's certain imbalances or structural asymmetries that begin to occur. In a healthy spine, the spine should be nice and straight up the middle, and from the side there's a natural curve and contour. And to the degree that you stay on those lines, you're going to minimize the amount of stress in your lower back or in any area of your spine for that matter. And so as we're talking about this in terms of, I really refer to it as your spinal architecture. So we want our spinal architecture balanced, symmetrical as much as possible. And so we can begin to start to take some of the pressure off of the area that's actually injured itself. Now, specifically in relationship to lower back injuries, okay? So in the lower back, there's a natural curve and contour. And so when we look at this here, we can see how there's a natural curve there. And sometimes what happens is people, when they're posturally holding their body, they have a tendency to overarch their back. You know, maybe men, they have a big belly here. And so how you hold your body is going to have a direct reflection on whether you have injuries to your back. Now, if your back injury is due to some sort of traumatic event, the same principles still apply. We want to create nice balance and symmetry within the frame, okay, as much as possible. The second thing that we're going to do is we're going to begin to start to give some support to the lower back and bring down the inflammation. We've spoken a lot about this on other videos. And so when we create some support, you know, I know maybe many of you have seen support back braces, right? So that go around the back here. It's not something that you want to do all of the time, okay? You can actually cause your muscles to begin to atrophy if you are really needing to wear a back brace continuously or for a more extended period of time. But in the short term, we can actually begin to create some support around here so that the back is not moving as much as it would if you didn't have the belt on there. So there's a couple different types of back braces and supports that you can use to support the back or to support through the pelvis here. Now, one really critical portion to healing back injuries is actually bringing down the inflammation. So, certainly we've talked about in these videos how ice is a natural anti-inflammatory, and we can begin to bring down the inflammation in the back or the neck or wherever you have these injuries here so that the tissue can begin to heal. And oftentimes what happens is people will tend to reach for anti-inflammatories or other meds that are going to maybe bring down the inflammation, but they may tear up your stomach or you may have other problems. So you may want to try ice first before you start going for heavier meds there, okay? But the main thing to understand about back injuries is they can take time to heal. And depending upon the severity of the injury that you have, you need to just take it one step at a time. Now, as your back begins to heal, as you get the support around here, as you get the inflammation that's coming down in your lower back, we want to start tracking our movements. So I'm going to show you exactly what I mean by that. So tracking the movements basically means that if I am marching in place here, okay, this is the direction that the body naturally moves in, okay? So when we're walking, we're going like this. Okay, any sort of asymmetries in your movement, crossing your legs, leaning on one hip, all sorts of things can start to throw your alignment off. And so as we start to track the movements, right, so the marching is one option here. Sometimes we've talked about in other videos about doing squats here against the wall so that we can, again, help to track the body in a straight manner. We get the symmetry right, support around the body when necessary, especially in more severe injuries, bring the inflammation down, and then begin to track the body in a balanced way. And with this combination, you're going to be able to take your back injury and start to begin to heal it. Now, the longer you've had the problem, the more severe the problem is. I see people who have been in auto accidents and all sorts of different types of scenarios where they have a serious back injury that really requires more attention and more treatment. So a lot of these things and these principles that I'm showing you is really about you taking care of yourself. And there is a time and place when you need to seek professional advice to make sure that you're getting the guidance that you need to be able to allow your back to heal as well as possible. So I appreciate you watching this video here. When you have questions, please post them below if you're not getting the solutions that you need. The next video we're going to be doing is how to fix your posture in 4 moves. Stay tuned.